It's like we're going.
And we are live.
Great, thank you. Welcome back, everyone, to the House Health Care Committee for the afternoon session on March 16th. So we are turning right now to our workforce discussion that we had a little bit of this morning. I'm going to walk through again each section and we'll do a straw vote on each section. So to follow along, on our web committee page under David Hall is draft 3.1 of the full commerce bill. So we're going to start on page, it's section 23, which I think is like page 20, but let's find it. I can read it if people don't really want to follow along. So section, although the numbers might have been changed because I think they were. Okay, so we are going to page 20, section 23. So it's page 20, row 13, section 23. The EMS training in fiscal year 24, the amount of $1 million. Okay, we're going to stop. Yes.
Just a process question. Why are we not looking at section?
We're going to go back to that. Oh, okay. That's okay. Let's just talk about the ones that we have talked about. So in fiscal year 24, the amount of $1 million is appropriated from the general fund to the Department of Health to provide training for emergency medical services personnel. We've talked about this. It's grants that are given out to EMS divisions to help training for recruitment and I believe continuing education as well. And so this is not matching funds. This is 1 million general fund. Any questions? All right, straw vote. Everyone in favor of allocating 1 million for EMS training, raise your hand. 1, 2, 3, 4, 5, 6, 7, 8, 9. Did I count that right this time?
Yeah.
Mary.
Yeah, but she's not using, I don't know if she's using her vote today.
Didn't the rules change?
Didn't the rules straw polls? You can. All right, Mari, are you there?
The rules change, we could, anyway, whatever.
Hi, yeah, I just finished my physical therapy appointment. So I kind of need catching up. What are we doing?
All right, so Commerce has put together a workforce bill. And if you remember, we had several folks come in, agencies, and asked for funding for workforce, that when we did our budget letter, we kicked it over to Commerce. They have now drafted a bill and we are doing straw votes on the pieces that pertain to healthcare.
Okay, and what are if I'm on the committee page, what should I look
So
at?
if you're looking under today for David Hall, draft 3.1.
Okay, got it.
So we're right now on page 20, row 13, $1 million for EMS training.
Got it. Thank you.
Would you like to vote?
I don't think I should on
Okay.
this one because I'm
That's fine.
just joining.
Okay, so 901. Okay, then section 24 is actually going to be, and Heather, this is for you, 24 is going to be stricken.
No.
Yes. No. This is mental health professional forgivable. I'm on draft 3.1. Is everyone on the same draft?
Yeah, what page?
20, row 17. It says section 24, Vermont Mental Health Professional Forgivable Loan Incentive Program. Are you on the same section? Okay. So from the healthcare perspective, we are not voting on this because this is the mix up between this and the other section for DAs and SSAs that we're going to recommend.
Okay,
So
they've merged.
there are two different programs. This one we're not funding because there's already money in it. So we can talk after on that.
Got it.
Okay. Then there's section 25. So now we're on page 21, starting on row 3. So this again is the Vermont Nursing Forgivable Loan Incentive Program. This is the one that VSAC commented on. This is forgivable loans for nursing for every scholarship they receive, or I shouldn't say scholarship. For every forgivable loan they receive, they would give 1 year of service. This has been in effect. We heard from VSAC that it's working well, but the funds are almost depleted. And so the recommendation is that we appropriate $3 million for this. 1.3 is from general funds and 1.7 is from global commitment. Any questions on that one? We ready for a straw vote? Okay, everyone in favor of allocating $3 million global commitment dollars for Vermont Nursing Forgivable Loan Incentive Program, raise your hand. That's 9, 10. Okay, 10-0-0. All right, so the next one, section 26, we've talked about this. This is actually what we put in last year for a healthcare workforce coordinator position. Do you want a straw vote on this one, Heather? I mean, it's
Sure,
all right.
if you'd like to.
Everyone in favor of continuing what we put in place last year for $170,000 for the healthcare workforce coordinator?
I'm just curious to know what happened from
Yeah.
last year.
Yeah.
So it's a 3-year limited service, so it's every
They
year.
hired someone,
Yes.
it's working, but we haven't heard anything back.
They just recently hired someone.
Okay, so not
And
really.
it's a 3-year.
Yeah. I just didn't know where it stood.
Yep.
So they recently hired someone,
Yes.
but it's not permanent?
No, it's a 3-year limited service position, and it was in our budget as well. So this is just clarifying language for the commerce bill.
If they recently hired someone though, then what happened to that money?
Well, we'll just keep going.
It stays in that position.
Yeah, but I mean, like, we budgeted 170 for 1 year,
To provide 1 additional year of funding.
but I mean, like, but what happened to the original funding if they just got hired, you know what I mean?
Do you know? We didn't take testimony in this.
Yes.
Like, what, that's 6
It rolls over.
6 plus 3, 9 months. What happened for the last 9 months with the money? That's what I'm saying. Like,
Well, it's like with everything else that went through, it just sits until someone gets hired, right? And so then this is for one additional year
I
of
guess
funding.
I'll say yes, but I'd like to know is, how is it rolling forward? What is it being used for? Because if 9/12, whatever that is, 3/4 of 170 grand didn't get used, and then we're giving more, it's like, well, where is that?
It was funded with ARPA money the first year.
But it didn't get used.
Right.
So I guess that,
So
we can come back to it later.
most likely, It was, it's
just
neither
seems-
here nor, I
yeah.
mean, yes, I get it,
Yeah.
but this is something we funded in previous legislation. We need to keep funding it.
Okay,
And we already passed the language for this position.
I
in our
support
budget.
it.
This would be the funding mechanism, but we already passed the language to continue this position.
Yeah, I support it. I just want to know at some point,
We will come back. to it.
yeah, what happened?
And we will come back to it anyway because we want to find out what
Yeah.
they're doing.
There's a report by the
Yeah.
workforce
The healthcare workforce.
task
person.
force that we can look at too and see.
From the hiring of it, but we would want to hear from this person about their efforts later in the session. All right.
I don't know if we can ever do this or if anybody has ever done this, but can we ever put a bill together that just for personnel? In other words, we do all these things and here we got a person in this bill and we got 2 in this bill and we got 5 in this bill and
You know where I think,
I would love to see a bill that just said, we are hiring in this year, these positions to do this, and this is the money it costs, because, just,
I think the place you're gonna get that is the appropriations committee.
exactly.
they can
Like a
provide
giant
that,
spreadsheet.
yeah.
Well, I'm not sure they have it in one place either, but they see all of it together. Yeah.
We can continue to grow this monstrosity, and
Right, but in the budget, it all comes together. But yes, I see your.
Okay.
Okay, so anyway, section 26, everyone in favor of the 170,000, raise your hand. 10-0.
I didn't see all the hands go up.
9-0, 9,
Oh, there we go.
oh, sorry. Let's do it again, everyone in favor. 10-0.
Well, I'm just saying, like, somebody's hand didn't go up, but I wanted to make sure they knew they were being counted.
Or not.
Okay, section 27, which is on page 22, row 3. So this one is a little tricky because we're making amended language to what is in here. So if you remember, we talked this morning, this is a program that has been working with the DAs and SSAs. It's a loan repayment or maybe forgiveness and tuition assistance for DAs and SSAs. And when in previous legislation that we passed this in, it was for staff, for full-time mental health and substance use disorder treatment staff at designated and specialized services agencies. Vermont Care Partners came forward with the proposal during the budget process when we were here a couple weeks ago, and is asking for it to apply to all DA and SSA staff. So where it says on row 11, full-time equivalent mental health and substance use disorder treatment staff, it will now read full-time equivalent all staff across the agencies.
So
That's the
gonna be
change.
changed.
Yes, I'm gonna give, if we pass this, I'm gonna give Commerce the new language. So it's just those couple changes. And then they asked for 6 million. Again, this can be matched. Human Services, who voted on this yesterday, allocated or appropriated 4 million, of which, according to Nolan, about 1.74 is general fund dollars. Daisy.
Under 20, is this 27?
This is
27,
this is section 27.
big D. Wait, was that 27?
So look at page 22, row 3.
So 23, row 7, tuition assistance for individuals pursuing degrees to become master's level clinicians. If someone is pursuing a degree, what is the eligibility criteria, or is there one? Because if I just look at this section, it doesn't look like there's a lot of eligibility criteria, and this looks fantastic. But is it any student pursuing a degree? Because
So it's and Julie's here that could also answer this, but it's so a DA or SSA staff who is pursuing a degree, they could receive loan repayment or tuition assistance.
right, but that implies that they're already employed at the DA.
Yes.
How
Correct?
are they employed if they're not already a licensed staff? For example, I know people who would love to enter this field right now. However, they're not licensed. They are pursuing a degree. And it is cost prohibitive because they can't get into the degree program, because to do so, they have to do 2,000 hours or whatever to get their counseling degree. And that means not working and paying for the degree program, and they don't have access to this program because of that. Does that make sense? It's like the cart before the horse.
Julie Chesler, Vermont Care Partners. We have a lot of folks who are doing both their bachelor's degrees and master's degrees. So there are employees, and they're being paid, they can be paid as a bachelor's level case manager working on their master's degree. We also take people right out of graduate school who have a master's degree and need the 2 years of clinical experience. In fact, that's our specialty. We take people right out of graduate school, they have 2 years of supervision, and then they leave us for private practice or a better paying job. Brian is.
Yeah, that happens all the time.
So People can be, and we have people like on our crisis teams that don't have their master's degree, but they're working towards it, they're getting the education, and they're being paid as professionals, and this can help them achieve their master's degree.
And Daisy, to the second part of your question, which is those who are not yet employed. So if you remember, VSAC was in and they walked through 2 programs they're working on. So one is the nursing program that we did, and the other, which is the Section 24, is the mental health professional forgivable loan program, of which they have $1.5 million. And that program for VSAC is going to start in September, I believe, for them to start just like they are with the nursing program. So if you want to go to school become a mental health professional, you could apply for access to those funds.
And those will have a financial eligibility criteria.
We can bring VSAC back in to determine what the criteria is for that if you'd like. Or you could reach out to
I'm
Marilyn.
curious because I've met several constituents who are trying to get into the field.
Right,
And
so
I'm
it's just
looking-
starting.
I'm just looking for making sure that when we pass things like this, we're sure that the opportunities are wide open to get as many people as possible in there.
Yes, so I would suggest you reach out to Marilyn Cargill at VSAC if you have more questions specific to that program that they're starting up.
And if you go on page 23, there's A and B. And A and B talk about people who are not in.
No, this is for those who are currently DAs or
We're
SSA
employed
employees.
already.
That's what this section is all about.
I thought that this was for people.
Who are employed but are pursuing degrees to go to the next level.
Okay, okay.
Yeah.
So it's actually, I mean, line
Why does it
7.
say prospective employees then? That to me is.
I feel like I can explain that.
Where is it saying? Go ahead.
Yeah, I think with that, just to reemphasize what we heard Julie Tesler say, like that designated agencies frequently hire people right out of college or in college. Like I started working at the Howard Center as a substitute while I was getting my master's degree. And then I stayed on as a substitute. Granted, I can't qualify for any of this because I'm not full-time, but I stayed on as a substitute for 18 years. But I did not have a license when I started working there. So a lot of times people might be applying for jobs, and this would allow a designated agency, a specialized service agency to say, oh, if you work for us, we can pay back your degree while you're earning your license. So then over the course of a few years, a person not only can get supervision and their license paid for, but they can get their degree paid for or supplemented. And that does sweeten the deal significantly when the pay is so low compared to other jobs because we keep failing to raise it. So we, the state.
It's recruitment.
Yes, and retention. Because someone who's there maybe like Julie Tesler said, they might be a bachelor's degree person or whatever. A person with a baccalaureate, is that the word? Whatever. Anyway, and then they're going to school they might go to school for their master's, knowing that it's going to get paid off by the agency, and then they can get a promotion and get paid more. So it's recruitment and retention. Like I see Julie's here.
Yeah, it does help with recruitment, because other like FQHCs are given $50,000 in loan repayment for a 2-year commitment. So that's why we wanted to expand it, because we can only give 3,000 to 5,000, but it does help sweeten it to help with recruitment. And then you have to, get through probation and make a 1-year commitment to get the 3,000 to 5,000 to help pay off your loan. So we now have people applying a second year to, keep working down their loan or to keep working on their degree. It's not a full loan repayment by any stretch of the imagination, because we all know how much school costs.
Yeah.
But it definitely is helping our retention. Our retention rate is, for these staff, is over 94%, and whereas otherwise it's only like 66%. So that's a significant improvement in helping us with retention, but it is also helping with recruitment.
Does that help explain
Yes.
everyone? Okay. And I agree with your point, Daisy, like we really need to make sure we're touching all places, right? So this is one place, and then we have that other program through VSAC, which is a different place for mental health professionals. Yeah.
I think this is also so much better strategy than hiring bonuses.
Okay, yes, Art.
But this bill is a commerce bill. Okay. Okay, so we're just.
We're just.
Making change, correct.
Right, so again, they're coming to us as the healthcare policy people.
Right.
Say we agree or don't agree with what's in here.
Okay, but
And we're allowed to make amendments.
Would we make,
we want to change the verbiage on 11 to include more people. That's what we're doing right now.
Yes, we are. And then we're increasing it to $4 million.
Okay, we're
11.
increasing it to 4 and we're doing that. That's what we got in front of us.
Yes.
what's
I
11?
just want to make sure.
Let's all have one conversation. Yes, that is what we're doing.
Yeah.
11 is row 11 on page 22 is what he's referencing.
Oh, okay, I was
We're
like.
just changing
okay.
some language.
I was just hoping that maybe Julie could give us some further clarification on why they're feeling the need to open it up to everyone. And I mean, to me, I'm thinking about like administration, to be honest with you. I mean, is this a license just to do loan repayment for administrators?
Thank you for that question. I greatly appreciate it.
Julie, why don't you come down here since it's becoming more of a conversation than I ever thought it would be.
You told me not to comment. I can't.
I did. I'm like, oh, we didn't cover.
Right now, the program's available to 66% of our staff, leaving the other 44% pretty pissed off and affects the morale and lack of trust. Some of the staff that we can't use this funds for are people who provide developmental disability services. So they tend to have the lowest salaries. It's really hard work and they're not eligible. And that originally happened because the first time we got these funds, it was from tobacco settlement funds. But I even have executive directors who still haven't forgiven me. I was like, I couldn't do anything, but they don't believe me. But we also have traumatic brain injury. We do choices for care. And we actually felt like we needed this for our administrative staff too, because we value them as well. And the chair of Commerce Committee said, well, what about clerical staff? He didn't want it to go to them because this workforce bill is really focused on professions that you need the investments in. But from our perspective, we're all working as a team and every member of the team is really important. And some incredible leaders have started in our field from clerical positions, including Mary Moulton, who we all met, Teresa Wood. A number of people started in different places. And if they decide that, hey, I want to move from the secretarial work or reception where there's a lot of work, then great. Like we want to keep building, having staff workforce development within the agencies. So for morale and because we really believe everyone's a member of the team and everyone has a potential to move up in the organizations and expand their education and change their roles over time and become leaders like Mary and Teresa. We can find more Mary and Teresas, that would be amazing.
Okay, good. All right.
So the 1.25 million is going to become 4
Yes, the 1.25 million was from last year's bill.
from last year.
Yes.
All right.
This is language from last year.
And it's ARPA?
Not anymore. It's one-time funding, but I don't know what it is.
And general fund?
There's 1.7 million is general fund.
Okay.
The rest is global
It'd be
commitment.
nice to see it so you know what the
Yep.
heck you're doing here.
It's confusing.
And just, this is the way I look at it. What's the difference of somebody coming off the street and doing this or somebody that's working in a clerical position in the agency now and they want to move up?
Right, and so for someone coming off the street, this could be used for recruitment.
Yeah.
Right,
But I mean, I don't see any difference. These are going to be employees. They're either, if you're a clerk or if you're coming off the street, you're looking for a degree so you can become one of these employees.
absolutely.
So I
Yes,
don't see any difference between.
yeah. Yeah,
I mean,
It's like back to my question.
right, this is, okay, so let's all take a deep breath.
Can I just clarify something? When I say administration, I was talking about executive administration. Hey, I started where I am as a secretary. So I'm more than cognizant of a path, but let's open it up to everybody, I'm thinking, okay, well, that makes everybody
Like a person even making
And-
6 figures.
And
Yeah.
so we can ask when this next round goes out to come back and have Julie talk to us about the specifics of, how many were given, how was the money used, all of that general wrap up, yes.
Yeah.
But this is a program that we have had in place and we're just expanding it. Leslie?
I think what's confusing me is that we're talking about multiple fiscal years in this one section. Because it starts with 2022 acts and results and then in fiscal 23, but we're talking about the 24 budget,
Yes.
right?
Because this is amending language in S11, which became Act 183 last year.
So what's going to be amended is section A.
What's going to be amended is section E of section 29E of Act 183. It's highlighted in yellow.
Yes, it's the amount of 4 million.
So we just changed that. It's going to say in fiscal year 2024, the amount of 4 million. That's what it's going to read.
Yes, I'm going to let Commerce figure out that language.
Okay, you'll figure that out. I
Yes.
completely get it. I'm just wanting to make sure I understand it.
Yes,
And so we're agreeing, but when we vote, we're agreeing for the change from human services.
we are agreeing with what Human Services also did, which is $4 million.
But the original recommendation was
staff.
6. I mean, it went. to-
Yes, the original request was 6.
So we're agreeing, what I just want to understand, we're agreeing to go from 6 to 4 and just from professional staff to all staff.
Yes.
That's what I'm thinking. Okay, got it. Okay.
I have to beat a dead horse.
That's all right, we were doing it really well.
Just so I know, this section is from last year's.
This section is from Act 183, Section 29E.
Okay.
This is language, this is a program we've already done.
All right, good. That's all I need
Yes.
to know. Yep. Got it.
Anything else? All right. All those in favor of $4 million and all staff, raise your hand. 1, 2, 3, 4, 5, 6, 7, 8, 9. All those opposed? 1. All right. 9, 1, 0.
I think that's an accident.
No, she
Oh, she had her
was on.
hand.
So, but she's still up.
Do you have a question, Mari?
Or has the sunset provision failed to kick in? For your hand?
Sorry, disregard legacy.
Okay.
Thank you.
Legacy.
So you're all not gonna like my next
Oh, boy.
statement,
Get over here.
but we're going back to the section that Alyssa first mentioned, which is section 1. I'm sorry, page 17, section 21, row A. We are not commenting on this because we did not receive testimony on this. This was a program that Commerce received. They received testimony on a program that the people who gave them the testimony suggested it change to this, and Commerce accepted that. We have not seen it. We did not take testimony on it, so we are not commenting on it. What I will say is we will come back to this later. At some point in the future, I'm going to have a session of testimony where we all completely understand what we're doing around workforce for healthcare.
That would be good.
We're not voting on it then either?
Nope.
Great.
We're not. Okay, so I think we're done with this. We're gonna stay on air for 1 minute while I talk to Heather and get ready to go over suicide prevention. So Katie, do you wanna come up and pull up the language? Just remember, we're still live, so no one go anywhere.
I'm just gonna get up.
Okay, that's fine.
Shrink this chair until we have somebody sitting.
I would.
Next week, huh? What's that?
I would pick on her room.
I like Chris's snowshoes. I have mine in my car because I didn't know how bad the snow was gonna get.
That was smart.
Oh, sorry.
Never know when you'll need them.
Aaron. Yes, I'm giving this all to you. And I will come back to you when we're done. If you have any questions.
Welcome back.
Thank you. Allison and Chris, thank you for wading through that.
Good afternoon.
Good afternoon. All right, so just to kind of bring us all back to where we are. So we agreed yesterday that what we were going to put forth in a suicide prevention bill is some intent and policy direction for our new suicide prevention director, who is with us again today. Katie drafted some initial language, so we're going to walk through it.
Very late last night.
And then we will have a committee discussion if we want to change things, add things. And the intent is to have a final document from Katie tomorrow that we can vote on. That's the plan if everything comes together. So, Katie, I'm gonna turn it over to you. So wait, it's on the webpage, right?
It is, I'll pull it up.
Okay, great.
Good afternoon, Katie McLinn, Office of Legislative Counsel. We're looking at a new draft of draft request 979 this afternoon. You'll notice that this draft does not have the suicide fatality review team in it. Instead, we still have a chapter dedicated to preventing death by suicide. Now there's only one section in this chapter. This is pertaining to the duties of the Director of Suicide Prevention. So this states that the Department of Mental Health's Director of Suicide Prevention shall lead the state's suicide prevention efforts, intervention supports, and postvention efforts, and collaborate with communities and providers to reduce the number of suicide deaths and attempts in the state. The director shall promote and support statewide crisis and suicide prevention recommendations as outlined in the state's suicide platform, including the creation of a strategic plan and suicide prevention education protocol for all schools. The director shall expand partnerships, implementing innovative data-driven initiatives, coordinate suicide prevention programs across the state, and work to secure federal funding. The next section is session law. So short term, and these are two reports that would be coming back to the General Assembly. So first, on or before January 15th of this year, the Director of Suicide Prevention, in collaboration with the Department of Health and stakeholders, shall develop and submit a statewide strategic plan pertaining to suicide prevention services, training, education, and postvention service to the House Committee on Healthcare and to the Senate Committee on Health and Welfare. This is the same strategic plan referenced in section 1. And then on or before January 15th, the Director of Suicide Prevention, in collaboration with AOE, shall develop and submit a statewide protocol for all schools to implement suicide prevention, education, and postvention services. So in your next draft, I'm going to indicate where we're submitting it. So we'll have it come to this committee and to Senate Health and Welfare. Section 3 is a presentation versus a physical report that would come in. This has to do with the Comprehensive Suicide Prevention Grant. On or before February 15th of next year, the Director of Suicide Prevention shall present information to this committee and the Committee on Health and Welfare regarding the work accomplished by the state in accordance with the CDC's Comprehensive Suicide Prevention Grant, including the results of the Complete Suicide Data Linkage Project. And that is it. Takes effect July 1, 2023.
Okay, before we do a lot of commenting, changing of the language, I'm going to have Alan comment, but specific to what Katie presented, are there questions about the language, not changing it, but questions about the meaning of some of the language?
Is that a question for me? Just making
No,
sure.
sorry, Chris. It was a question for the group, but I think we're good. So Chris, would you like to comment, knowing that we still may change it, but would you like to comment on what is in front of us? You or Allison?
Yeah. So there's a few things that, thank you for putting forth this language as well. It's really helpful, especially being in a new role. So I appreciate the time and effort put forth on this language.
No, probably keep
There are just a few things that we wanted to look at in section 2. I believe that we were okay with everything in section 1. Is that correct, Allison?
Yes, everything in section 1 is good. We just have a slight, we'll send you an edit with just a couple technicalities on what things are named.
Okay, great.
And then looking at section 2, we just wanted to talk a little bit about the timeline and expectations regarding what would be completed by January 15th. I think, so my hope is that we do have a strategic plan, and I also want this plan to be done right and properly. It's our first plan that we'll have for the state of Vermont, centered on suicide prevention. And so my hope is that by January 15th, we would be able to provide an update on the development of the plan. And we can discuss a little bit, maybe more of what those deliverables would be by January 15th. Certainly, you know, since I'm really new within this role, my hope is that over the next few months, and I'll need to be able to engage the Suicide Prevention Coalition on this effort as well. And we have an upcoming meeting with them in early April, and also wanting to spend some time with other stakeholders to make sure that they're fully on board, and that the suicide prevention platform, which is set to be updated by fall of this year of 2023, for that project to be completed. As part of that project would help inform the strategic plan. In addition, the suicide data linkage project, which Caitlin has presented on, that will be completed in September of this year as well. And so I'd want both of those to be completed in order to better inform the strategies moving forward that would be within the strategic plan.
Thank you. Questions?
Are you?
You know what? I'm sorry. Since he's not referring to specific language, why don't we take the language down so we can see him? Okay, sorry.
Okay, in terms of what I heard you say, you want that work done before you embark on the plan. So that means you couldn't start the plan until after November. Am I listening?
We can start the stakeholder engagement, and we have Chris has plans to do consultation with Colorado, which we do think will inform the timeline. I think what we know is there's a few big pieces of work that won't be finished until the fall. So we know that it'll still be, some big decisions will still be likely in more draft form. So what we were hoping to do was create a list of tangible deliverables, but not be beholden to a finalized plan, knowing that we'll have a draft that will need to go through lots of stakeholders, and that draft won't be technically able to even be completed until at least November.
So you're asking for a progress report for January 15th, really? Back to us.
Yes.
Yes.
And then do you have a timeline that we could put in here for the potential actual plan deliverable?
The request is to push it out 6 months.
So July
15th.
So July 15th,
Correct.
which we're not in session
Of 2024?
of 2024. Brian?
Yeah, I'm not against this or anything. I just want to acknowledge that what it would mean in reality is we wouldn't see the plan until the next biennium.
Right.
So if that's the case, a question I have, and we don't have to answer it today, is there anything else we can do as the legislature while the plan's being worked on to address the high suicide rates? I mean, like, we don't have to answer it right now, but because that is concerning to me that we might not have a coordinated plan until 2025, you know?
Well, they will have a coordinated plan. We just
Right.
won't have seen it.
Yeah, but I understand it takes time if you're gonna do it right, so I'm not trying to rush anyone. It just weighs on me, how serious the issue is. So, and I guess maybe as I'm talking this out, maybe it's the plan, we get an update on the plan, but in 2024 July or whatever, but maybe we just regularly check in with
Right.
people, you know, as we make the budget and stuff like we normally do, and we just stay committed to the issue even though we don't have the plan yet, you know?
Well, I was going to suggest, based on what you said, that we have a progress report January 15th and one on April 15th. Would that be appropriate so that we get an update before we're leaving?
Okay.
I like that.
Okay.
That, Chris?
Yeah, that's totally reasonable from my standpoint. I think that works.
Alyssa and then Art.
I'm just thinking about fiscal year 25's budget, which the recommendations for the budget will come in January of 24. If there's no plan, but they're anticipating that the plan will be complete in July of 24, which is the start of the fiscal year, then they really can't even implement anything in the plan because there's been no money appropriated, which means then we're looking at
26.
budget adjustment, or we're looking at 26.
Right.
I think
Unless the
there's
progress-
things we'll know.
Yeah.
So I do want to name that. Like, I think what we're saying is this says we'll have something finished with a bow on it. We will have the data linkage project, we'll have the platform, and what we will be able to give you is the ingredients that are in draft form for the strategic plan. So I think we'll be further along. We just didn't want to have to commit to this published plan. We also want to align it with the other department's strategic plans, and we just expect that's going to take a little time for it to be official.
Yeah, and correct me if I'm wrong, Allison, and Chris, I'm only directing this to Allison because she has the history, but I mean, when we say putting together a plan, there's a whole lot of time that it has to actually go through the appropriate levels within the administration as well, right? So I think that's part of, but maybe we could put some language in that says on it before January 15th, 2024, we'll have a progress report. And what I anticipate us doing once we get past this little bit is like one of the things I would like to see included is 988 long range funding plan. So maybe there's a couple things that we say we would also like some expectation of by January 15th on these couple things because they would be related to a budget. And you can't agree to that yet because you don't see what they are, but I'm just trying to find a way to incorporate what Alyssa's talking about, which is a really good point. That we're having the conversation here, which also expresses our intent that, you know, we want to move some things along here, and obviously the budget is a big piece of that.
I would say the budget's a big piece of that for 988, and I would also offer, feel free to nail us down on recommendations. I mean, we may not have our long-term strategic plan, but we will have a lot of new information.
Hold on, we have a lot of people, so I know we have, are you done?
How about we change the wording to on line 15 of page 1? The director shall promote and support statewide crisis and suicide prevention preliminary recommendations as outlined in the platform, which is still kind of preliminary.
So what we want to do is we don't want to change section 1, right? Because this is what we want the duties of the director of suicide prevention to be, but the next section. Yeah.
Okay.
So let's hold wordsmithing for a minute.
Sure.
just, I want to get the general concept of what we're trying to do. So Art,
What I suggest we do is, since this is a very important issue, I think, to the committee, in my opinion, I'd like to get an update in July. I'd like to get an update in October. It doesn't have to be anything huge. I mean, we get monthly reports on child waiting in emergency room.
we get weekly, yeah.
Why couldn't we get every 3 months, just something? It doesn't have to be a full-blown thing where we spend hours putting it together, but we're working on it. We've run into these problems. This is accomplished. Just keep us updated. To me, that would be something, and then in January, maybe something more involved. But I mean, if we get to January, we haven't heard anything, and no offense, Chris and Allison, but you're way behind or stuff that, it'd be nice to know ahead to me.
Chris and Allison, I'm looking at you all. I don't know, Allison, if you're, Chris, you're aware what we get from DMH now that Nicole is providing us. She's doing it about once a quarter where it's just some, it's a 1-page update. It's not a report. It's not, anything extensive. So would you be willing to provide some data, some summary of what you've been doing back to us while we're not in session?
Sure.
I'm very comfortable with that.
Yeah. That just helps with the communication as well. And if there's issues along the way, we can mitigate that quicker rather than later on.
Great.
I like that.
Daisy, and then Brian, and then Leslie.
I guess the first question is around section 1. Do you feel like that aligns with the duties that are already in the agency's job description for this role?
Yeah, I'm glad you asked that, Daisy. That was one of the first things I took a look at when I saw that. We just wanted to make sure it wasn't off, and it is in line. I think the only issue, and it'll come up also when we get to section 2B, is the piece around informing school protocols. That hasn't been really a named piece of the role to be specifically, trying to develop or implement for quote all schools. So that's something we want to talk about, but all the other language is absolutely in line, and developing guidance for schools is absolutely in line. It was more the piece about potentially implementing and playing a role in standardizing for all schools.
So can you provide suggested language back? Because we do want to put in here a connection with the schools, because we think that's a really important part of the whole statewide. So if you can provide some suggestions back on that, that would be fabulous.
Yes. We have some already drafted. So I've got a page that we'll send you as soon as we're finished.
Okay, thanks.
And then my second piece was sort of bordering on wordsmithing for the content of the strategic plan, because I remember in report writing season kind of grappling with language or wording around what are they expecting us to send them. And so I just appreciate us taking care to be clear with what would be in the strategic plan.
Okay. So let's hold on wordsmithing.
Yeah.
Now. Okay.
When it comes time, I'd be happy to work with you on that.
Okay. Leslie?
Well, I'm not seeing anything here about sort of, and maybe this isn't the place, about sort of the drivers of suicide, of how depression fits in, how poverty fits in, how, those kinds of issues lead to despair. And I'm not necessarily sure that a suicide strategic plan should include that. But I feel like we're starting halfway down the continuum rather than at the beginning. And I'm not sure that, as I say, that this is the place for it, but I feel like it's missing. Well, it's missing for me. And I don't know, Chris and Allison, how that fits in. I mean, yeah, I guess that's my feeling, that there's an absence of understanding the drivers of suicide. I know we're not talking about the impulsive pieces, but the other pieces of when people go do that.
I think that's a great question, Leslie, and I'm glad that you're bringing it up, because I think that's a big piece of what the Suicide Data Linkage Project is, in terms of determining what those social determinants of health are that someone is going through prior to dying by suicide. So I think that's a key component of the Data Linkage Project, and will help really inform the strategic plan as well.
And so to take it one step further, and I made a list of a couple things. So for instance, once we get past this general concept of what we're trying to do, work on, to Allison's point, some recommendations within this, and Daisy's point of what exactly do we want from the strategic plan. I see us saying something like, including using the suicide data linkage analysis in a report to help us understand social determinant, help us, I'm just.
Causes or whatever.
Causes or something, and policy recommendations would be part of the strategic plan.
That helps me. I think that one thing we noticed yesterday, that the linkage project was very government focused, and that there really wasn't data from community. So I feel like it's a little isolated, or I was concerned about that. And how do we interweave those? So I was hoping the strategic plan, I don't know where to look, I'm sorry.
Well, so that's okay. So, and yesterday we talked about, and Chris talked about this specifically, like, okay, or I'm sorry, Nick, we look at the suicide data linkage report, that's also going to tell us what is missing. So again, we can word it however. So we are going to have all this data, but then what's missing? What aren't we still understanding? And what's the strategic plan to get that data to inform policy, right? So, and Allison and Chris, I don't want to speak for you, but that's how I envision this working.
I like the language you just used about, making sure that there's should be a process utilizing the data linkage project to have a data-driven strategic plan that gets at root cause. And I think if you want to put something down, we can help refine it. I like that. I hear you, Leslie, on, there's limitations to the data that we can get at. I think what I appreciate about the Department of Health is they're coming at it scientifically, because at least this data set, every person has the same likelihood of having data in this system, where when you go out to community partners, your bias is coming in based on, like, we know more about this person because they happen to be here or there. So I think we're trying to take that balance of like chasing one person's story versus actually grounding ourselves in what's more likely versus less likely than the regular population, or the population who has not gone on died by suicide.
You good, Leslie?
Yeah, for the moment.
Right.
So just two possible suggestions to strengthen this. One would be, we've talked about wanting some kind of update versus the final plan. We've talked about in January or February 2024 wanting an update. And so I'm wondering if we could ask for something like a progress report with preliminary budget recommendations. Even though you give us budget recommendations anyway, it might be good to have it, by February, you shouldn't be, the governor's budget's usually been presented to us, I think, right? But so it might be redundant, but it might be nice to have it in the progress report too. So it's like we see where things are at and what money is needed exactly for what, because when we get the budget recommendations, it's this big thing that's confusing. So just that might be really useful for us and the public. And so if that's not too much work, I would suggest we be specific about that, or at least you hear it now and and then the other piece, and this is very nitpicky, but I think it's significant, is that in section 2, when it's talking about the strategic plan, it has a part A and a part B. And in part B, it says that you're going to work with the agency of education. In part A, it says the Department of Health and stakeholders. I would suggest that we change it to the Agency of Human Services and stakeholders, because then it opens the door to also communicate with DCF and with Dale and with, all these other pieces of government that are working with people besides the Department of Health, but it still includes the Department of Health. And then this way, I just think that that's more holistic if we're looking at all the pieces of government with people, because it might be through DCF that someone gets help. It might be, and when we talk about social determinants, economic services is one of them. So I guess that's a minor edit, but I think it could have a major impact. And it also creates a sense of like symmetry between these two things, because one is an agency and another's an agency, not one is an agency and the other's a department. Okay, thanks for listening to my nitpicky micro suggestion. I don't know what people think about that.
Hold on, Allison, did you want to say something?
It's really in line with what we're about to do, which is bring back an AHS suicide prevention policy team, which is forcing the issue Brian's talking about. Okay. So, and we don't have enough, and we own it. Where DOC and DCF have been at that table. We also have Dale, and we know people with disabilities are at high risk. So, spot on.
Okay.
Art, and then Daisy, unless you have a clarifying question.
Yeah, I wanted you to clarify, you said in AHS, there was a team and now you are just reassembling a team? What is that? We have not heard of this before.
Yeah, so myself and Tracy Dolan co-chaired, we're involved in having this AHS policy team. It fell apart during COVID. And so this would be with this position, we intended to have it brought back. So it was at the time a great idea. A lot of good things came out of it. It's how we ended up applying for the CDC grant in the first place. But it needed some dedicated time and staff, which we now have.
You're going to be a busy guy. Art, and then Daisy.
Yeah, and I just have a comment. I think we need to be cautious of hemming these folks in with things and allow them to do their job as much as we possibly can. I don't care what agency they get a hold of. If it prevents suicide from happening, that's a good thing. They can go to transportation for all I care. Okay, if it gets the job done, that's what I want to see. So I would have in language around what they should and shouldn't do. I, for one, want a wide open thing. You come back, but you got to do something. But you come back with us quarterly, tell us what you're doing, and where are we in January 15th?
And I appreciate that, and I don't think there's anything in here that would prevent them from doing something
I just
that we don't have in here. We just want to make sure that they're at least doing what the policy direction that we would like to see. So
I feel like we're setting a floor, not a ceiling.
there you go.
Oh my God, that was such a legislative term.
As I'm listening to the ideas and I don't know, throughout the conversation, I go back to the current draft as written, and I kind of prefer what's here rather than some of the ideas we're tossing around in terms of what the strategic plan should look like having a potential budget to it, because with the processes in the agency, I know it would be unlikely that we would see a draft strategic plan even a year out with numbers attached to it, because to get that approved at the agency, I mean, that's basically a budget request. They wouldn't.
Right. And so I just,
can I finish?
Yeah.
I think that I'm suggesting that we keep in mind that simplicity is sometimes a good starting point, and it might allow us to see something that inspires something that's more timely ultimately, right? So making it more complicated, it might end up not being as timely or relevant by the time we see it. And so if we do keep it simple, which is what the draft here really is it something that covers the suicide prevention services training and education, which is the actual rubber hitting the road that Leslie was talking about. Maybe that's good enough. And then the budgeting and all of that, I feel like is something that if it's going to come out and hit the legislature, it would have to be approved by their secretary, and I feel like that would be hard to get through.
So I want to draft the language that the budgeting pieces aren't necessarily tied to the strategic plan specifically, but I specifically want in here 988 funding plan by January 15th. So whether we, that's just an example, like whether that's part of the overall strategic plan, yes, it should be. But because we want to make sure that we can fund 988 going forward, I'd like to see that as part of the preliminary analysis or recommendations that come to us in January. That makes sense. I'm not trying to, I don't think any of us want to make this so onerous that they can't do it. But I do want to make sure there's certain things that come back to us that's important to the committee. So I think we'll have a good balance of what's
Right.
This is such a wordsmithing thing, but I think it's important to mention.
Can we just hold on the wordsmithing for once?
Well, it's something that it's very simple that they could just answer yes or no. That it says in section A, it says the Department of Health and stakeholders. In part A, in part B, it says just the Agency of Education. Like, is there a reason why stakeholders is listed in one and not the other, or should they both say like agency and stakeholders? It's a simple question that could just be resolved right now. So I know I didn't want to hold on it because it could just get done.
Chris or Allison, do you have a comment on that?
You mean in collaboration with?
Yes.
Yeah. Like, could it say and stakeholders in both part A and B? Or is there a reason why it doesn't say and stakeholders with the Agency of Education?
I think it just doesn't say it because we didn't ask for it.
Oh, okay.
Yeah.
And I think in this realm, stakeholders is referring to all of those Center for Health and Learning, AFSP, or I can't get but the ones that they're working with that are actually doing the work. I mean, not that you're not doing work. I didn't mean that, but I think that's what the stakeholders is.
But we are saying have it listed both places.
Yeah, because there's stakeholders that work with the Agency of Education too. So why not leave the door open for you to be like, we're going to include more people if we think they're a stakeholder. That's all. It's all it is adding and stakeholders to after.
Yeah.
Like the schools.
Yeah, exactly.
They're going to be impacted.
Or the student group.
Yeah.
So when we heard from AOE, we were hearing about all this stuff in the community. So I mean, I just would rather leave the door open, like others have said, so that you have maximum flexibility to like include people in your plan, And maybe we don't need to say it, but I'm just looking at, I'm just scrutinizing it because we've been sitting here for a while.
Chris and Alan, you keep going on and off mute, so I didn't know if you wanted to say something. I mean, Chris and Allison.
I'm in favor of that suggestion. I think it makes sense.
Okay. So we kind of hijacked your discussion here about the language. I think we only got through A, or maybe even not A, before we hijacked. So I'm going to turn it back to you, Chris, to see if there's other things you want to see changed.
Yeah, so just moving along to B here. The honor before January 15th. Happy to collaborate with the Agency of Education. And I think really what it boils down to here is that we'd be offering that I would, in collaboration with AOE and their stakeholders and stakeholders that DMH works with as well, that we would develop a model protocol that schools could adopt.
Our issue was with the language of that all schools to implement, because we don't have the authority there, but I think we get at your intent.
Okay. And once we have a protocol, we can determine if we want to enforce it and mandate it. So I think that makes sense, that it would be a model protocol.
Should we say that they might or that they may implement, or do we have to change the language, or that's I guess the question?
I think we do, because they don't, as Chris is saying, DMH doesn't have the authority to require a school to implement anything, but they would create a model protocol.
That all schools may implement or something like that.
Yeah, available to all schools.
Yeah. Yeah, and I see Katie writing, so I think Ledge Council will fix that. So
Yeah.
I won't try to fix it.
And I think Allison and Chris are also gonna send some language
Well,
suggestions
we
if
can't,
I
though.
gathered that. So,
We can.
so Leslie, hold on, I'm gonna let Chris finish before we go in again. So any other comments on the language, Chris?
Not on B, and then moving along to section 3, that the Department of Health, in collaboration with the Director of Suicide Prevention, would present to you all and the Senate committee.
Yeah.
So it'd
I had a
be,
feeling you would want to change that because they're in charge of the grant, so that makes sense.
yeah.
I missed that, I'm sorry.
So on section 3 on the presentation, on or before February 15th, the Department of Health, in collaboration with the Director of Suicide Prevention, shall present. And can we change that to January 15th?
So it's a presentation, so you will only be back for like a
Oh, yeah,
week
good
at
point.
that point. So I pushed it back to give the committee time to fit it in your schedule the first month of the.
It says on or before.
So can we, my issue is I want to make sure we see this before we start talking about the budget. Can we say January 30th
I was gonna suggest February 1st,
or February 1st?
So I think the 30th is great.
Can we put in here that they send us the results of that because they said it would be done in November?
It is, I think.
If
Yes.
you complete it in November, can they
January
send the
29th.
results of
So
prior to?
Katie, can we also add somewhere in there that the Department of Health will send the results to the committees upon completion of their suicide data linkage project? Because that supposedly is going to be done this fall, and then have the presentation on whatever date you pick. Okay. Leslie.
Well, if I remember right, the schools already have a policy for harassment, et cetera. And I don't know if there's a distinction between protocol and harassment. Protocol and policy, but trying to be consistent of what we ask of the schools, that way they create a policy. I don't know how that.
So that would have to actually go through the education department, so
Yeah. I just want to be the language to be consistent with what they already do. with
Well,
policy.
Right, so this may not be something like, I don't see this protocol, at least as the model comes back to us, would be step 1, right? And then step 2 through who knows how many would be how does it get implemented within AOE or within the local school district? I would think at that point, either we would take that up next year or it would actually fall under the jurisdiction of House Education. And I've been keeping the chair of that committee updated on what we're doing here, so that can be a conversation that we can have. But this is just a model, right?
Yeah, because protocol for me means telling them what to do, whereas policy is the overarching concept, sort of what we do, and then they decide what they're going to implement.
Right.
I'm just trying to understand that distinction.
Allison?
Oh.
Just quick, I apologize. Our commissioner's out today and there's a fire that my attention. So I was
Okay.
gonna.
Oh my God.
Leave you with Chris, not an actual fire.
Oh, we
It's only
don't
me.
we're very concrete here.
All right, so just Allison, just real quick, and we'll say this with Chris later too, but we need to vote on something tomorrow if we want to get it out for a crossover. So whatever language suggestions, if you can get to Katie and Alyssa and I tonight, or as soon as possible, would be great.
Yes.
Okay. Okay, thank you. So Chris, you're staying though, right?
Yeah,
Okay, so.
won't be firefighting today.
Okay, good. So Leslie, but I understand where you're coming from, but I don't want to get into policy changes of AOE in this legislation because that is not our jurisdiction. That will come later. Okay, so I'm going to make a suggestion. Go ahead. Did you have
No, I
something?
had nothing. I was thinking about.
Oh, I'm going to make a suggestion. I think we are getting there. And I think rather than all of us be on YouTube wordsmithing and adding, I'm wondering if a small group of people would like to get together and come up with anything else we need in here, for instance, 988 funding plan, or other things we've talked about, and be able to give something to Katie, in the next hour. And then we will have a draft and come back to this tomorrow. Is anyone interested in doing that? Daisy, Alyssa. So they'll be the key people sitting here and work. And then if anyone wants to add anything, see them. Does that work? And if anyone else wants to join in, join in.
And Chris can talk with them still, or off the record, or can you?
Yes, we can. Chris, if you have some time and can stay on Zoom, could you do that? We just won't be on air because it won't be a full policy committee meeting.
Yeah, I can stay on for like another 15 minutes or so.
Okay.
15, 20
great.
minutes, is that all right?
Okay. Yeah, and then what we'll do is once those recommendations come to Katie and I, we'll make sure you see them pretty quickly as well. So it's crossover, so hopefully everyone understands this is how it works. But at the same time, I don't want Katie working, all night long on this. So let's try and get some things ironed out here as a small group, and we'll come back to this tomorrow. Okay. So tomorrow we will be here after the floor. We'll be having a committee discussion on our favorite subject, compacts. Yes. With a potential vote. Oh, right, sorry. We actually have to be in tomorrow at 9. Thank you. Hopefully that's not a problem. Tomorrow morning at 9 a.m. Judiciary is coming back to tell us about their amendments they're making to our H230, and we will have to take a straw vote. And then H230 is the first suicide prevention bill. So if everyone can be here at 9 for that, then we'll go to the floor. Then we'll do the psychology compact with a potential vote, and the drug repository with a potential vote, and then suicide prevention with a potential vote, and then we will be done. So thank you, everyone.